In this video, I'm going to teach you about the basics on pelvic organ prolapse in postpartum women. This is important because this is a common postpartum condition that could potentially be avoided or prevented just by being aware of it, respecting it, and taking the time to recover before getting back to certain activities. By the end of this training, I want you to just know the basics of know what pelvic organ prolapse is from the most basic level, what causes it, how it's treated, and what are some treatment, what you can do if you think you have prolapse. So what is pelvic organ prolapse? It is the loss of the support of the pelvic organs, and the result is the pelvic organs place pressure on the vaginal walls and the vaginal walls descend. Imagine you were laying in a tent. The tent's closed off. You have a front wall of the tent, the back wall of the tent, and the top of the tent. Say someone falls into the front of your tent. They're not in the tent with you, but they're in your space. That is a cystocele, or the bladder and or urethra falling into the front vaginal wall. If this were the back, that would be the rectum putting pressure on the back vaginal wall. If it's the uterus from the top, that would be a uterine prolapse. You can have more than one vaginal wall that is descending. So I just mentioned what all the different types are. You can also have a rectal prolapse, but I'm not going to cover that on this training. The degree of prolapse can be from none to very severe, and it's graded typically by a urogynecologist or a gynecologist. And there's different grading systems. But as a PT, I don't diagnose them. I just call them vaginal wall descent and mild, moderate to severe. I think that I would like to see both the physical exam signs, and then I also need to hear what the patient's symptoms are, what a person's symptoms are. It's important to know both. Common symptoms with prolapse are vaginal pressure or feeling of heaviness, the feeling that something's going to fall out, just general fatigue, lower back pain, pelvic pain, sexual dysfunction, urinary dysfunction, difficulty fully emptying your bladder or urgency, difficulties with defecation, that could be constipation, that could be incontinence, that could be inability to completely empty, and urinary leakage or fecal incontinence. I didn't include this, but I just want to quickly review it. It's diagnosed, like I said, from a physician, typically a urogynecologist or a gynecologist. And then the exam process is a physical exam. You can be examined. I highly recommend you're examined by both providers, a urogynecologist and a pelvic health physical therapist experienced in this area. I tell my patients that to be aware that the physicians are a little bit more scary. Whereas if you see a pelvic health physical therapist before, you will likely feel a lot better about it. So just saying, it's a physical exam. The physicians use a speculum so they can see the top of they can see the cervix in the position of the uterus. Whereas we as pelvic health physical therapists can't. We just do a digital exam and we move the walls out of the way and have you do certain things. I could tell you that a physical therapist is going to have you do a standing exam, whereas your urogynecologist and gynecologist will not. I'll be surprised if they do.